Well, good afternoon, everyone. Today is a very special day that should instill us all with optimism and hope. As of this morning, the first shipments of the first FDA-approved COVID-19 vaccine have arrived in Illinois. There are many scientists and researchers who deserve our admiration and thanks. But today, I want to offer my gratitude to all the truck drivers and pilots, logistics specialists, warehouse operations managers, and law enforcement officers who have spent the last few days and weeks deploying the largest national mission in a generation. In their humility, they would say they're just doing their jobs. But by doing so, they're saving lives. Earlier today, I joined the Illinois Department of Public Health, the Illinois Emergency Management Agency, and the Illinois State Police teams receiving the Pfizer shipments on the ground at our strategic national stockpile warehouse. As we speak, our vaccine distribution teams are putting into action what they have prepared and drilled for over the past several weeks, carefully taking inventory of tens of thousands of vaccines, repackaging the vaccines, and preparing those packages to ship out to our hospital distribution centers tomorrow and Wednesday, the timeline requested by our partners on the ground. Remember that the logistics of these first vaccine shipments are the most complex because maintaining ultra-cold temperatures until the very last moment is essential. Once the packages are received by medical providers, they have only days to use the vaccines, which is why most hospitals have carefully planned their desired delivery schedules over the next several days. Illinois Health and Hospital Association President and CEO A.J. Wilhelmi will join me today to talk about our collaborative effort to ensure this vaccine gets into the arms of as many frontline healthcare workers as possible to minimize any waste. The shipment we received today is roughly half of our statewide allocation for this first round, excluding Chicago. At the recommendation of the CDC and medical professionals, a portion of our vaccine will be shipped directly from the manufacturer to 4 of our larger public health departments in Cook, Lake, Madison, and St. Clair counties. The federal government will deliver these shipments later this week, and we are working closely with these local health departments to prepare. In other words, today marks only the beginning of the national vaccination rollout. This week, the very first recipients of the very first phase will receive their first of 2 doses of this COVID-19 vaccine. To put it in perspective, in total, Illinois will be receiving about 109,000 doses this week. Nationally, there are approximately 24 million people who the CDC classifies as Phase 1A. Our destination is clear, but the road ahead will be long. Starting next week with the potential FDA approval of the Moderna vaccine, Illinois will begin reserving portions of our weekly shipments for residents and staff of Illinois' long-term care facilities. The federal government is directing and managing that distribution and those vaccinations through federal contracts with CVS and Walgreens. Across the next 3 shipments, the federal government estimates providing enough doses for all the skilled nursing facilities that have signed up through the national program. From there, it's expected to expand to other congregate care settings, such as assisted living facilities. CVS and Walgreens are reporting extremely high demand across the nation, and as they share information on their timetable with us, we will share it with you. Let me echo the CDC's Advisory Committee on Immunization Practices in emphasizing that while this vaccine has been developed at an incredible pace, it's gone through the formal regulatory process in a very transparent manner. under arguably the most public scrutiny of any vaccine candidate in human history. Our own Illinois Independent Review Board today released its findings after spending the weekend ferociously diving into all available FDA data on the Pfizer vaccine. And I'm pleased to say that the team has unanimously endorsed the CDC's recommendations on the vaccine. These experts are currently working with IDPH to update our COVID-19 FAQ document on the IDPH website with answers about the vaccine. We want everyone to be able to access the facts as clearly as possible as we have them. One of our review board members is with us today, will join us a bit later to speak with the public directly about the safe design of this vaccine. Dr. Michael Olson, an assistant professor of medical microbiology at Southern Illinois University's School of Medicine. I know that there's a lot of information coming out about this vaccine all at once, so I want to quickly run through the recommendations that the CDC put out over the weekend so that Illinoisans have all of the most up-to-date information for the decision when it's your turn in line. To start with, CDC Director Robert Redfield signed off on recommending the vaccine to all Americans 16 years of age and over. The CDC has also offered additional clinical considerations for certain groups, and I want to bring you up to date on those. For those who have had severe allergic reactions to vaccines in the past, the CDC said you can still get this vaccine when it's your turn, but you should discuss the risks with your doctor if you choose to do so. The CDC does not recommend special precautions for people with just non-vaccine allergies, like to bees or peanut butter. The CDC has also recommended that pregnant women have a discussion with their doctor, weighing the risk of taking the vaccine or waiting for more data on vaccine safety. A report from the CDC last month noted that pregnant women who get COVID-19 are at increased risk for serious complications compared to non-pregnant women of the same age, but we don't yet have data on how the vaccine would affect pregnant individuals. While medical experts have traditionally recommended that pregnant and breastfeeding women avoid vaccines made with live viral material simply as a precaution, the Pfizer vaccine does not contain any viral material. And other vaccines like the flu shot are routinely recommended during pregnancy. As soon as the CDC or the FDA offers additional information regarding this vaccine and pregnancy, you'll hear it from me. But with the data to date, they have determined that this is a decision between a woman and her doctor. Today marks a momentous occasion, not just this year, but in American history. 11 months after scientists the world over got their hands on the genetic sequence of the virus, we are seeing the beginning of the end of this pandemic. This is an incredible testament to our research institutions, to our scientists, to the medical professionals who worked tirelessly every day of this battle without ever knowing exactly when this day would come, but holding out hope in their hearts that it would. And here we are. May we all take a moment to feel that hope today. So thank you, and with that, I'd like to turn it over to IHA President and CEO A.J. Wilhelmi.
Thank you, Governor. Good afternoon. I appreciate the opportunity to join you today on this very hopeful day, as you just said, very eloquently. And let me say at the outset how much we all appreciate your strong leadership, as well as the leadership of Director Ezike, and how much the hospital community appreciates and values our partnership. As the governor has mentioned time and time again, hospitals and healthcare workers have been on the front lines in the COVID-19 pandemic all year. And we're on the front lines again as the vaccination process begins. The hospital community stands ready to play a major role in the vaccination process by serving as distribution hubs and vaccinating at-risk healthcare workers so they can be personally safe and also available to care for their patients. Hospitals are preparing to receive vaccines this week, as mentioned by the governor. Their teams have prepared internal vaccination plans. They're communicating and planning with our government partners and with their local health departments to be sure this complex and logistically challenging process goes as smoothly as possible. And we know this, vaccine demand will far exceed supply in the first couple months. So our hospital leaders are urging calm and patience as the vaccination process plays out. We also know that the vaccination of the people of Illinois will require a thoughtful process that will take months, not days, and we're committed to doing this right. The stakes are too high to rush through it. And so hospitals will approach the vaccination process in a planned and orderly way that allows us to balance timely vaccinations of our most at-risk healthcare workers with maintaining our ability to best care for our patients. And of course, it's critical, as the governor said, to implement this process in a manner that doesn't waste vaccine. IHA and the Illinois hospital community stand with Governor Pritzker and Director Ezike in fighting this pandemic and in urging everyone to pull together for a few more months. Mask up, social distance, wash your hands, and when it's your turn, please get vaccinated. We're extremely pleased to be in a position to turn the tables on this virus, and we look forward to working with Governor Pritzker and Director Ezike to do our part to effectively execute on the vaccination plan. And so again, Governor Pritzker, Director Ezike, thank you for your strong leadership. It's a real pleasure and an honor to work with you on this very hopeful day and in the days to come. So, Governor, I'll turn it back to you.
Thank you very much, AJ, and thank you very much for all the amazing hard work that you've done to support our healthcare workers, our hospital systems in preparation for the distribution of this vaccine.